Hi, my name is Dutch Rojas, and for more than 20 years, I've been on a mission to make healthcare affordable and accessible for everyone, everywhere. Today, I want to talk disruption. The real disruption in healthcare? It's simple, and I talk about it all the time: transparent prices. Physicians could transform the industry overnight if they post what they want to collect. Think about that. What does that do? Number one, the insurance industry loses its chokehold when patients know what a procedure costs. Insurance loses the mystique it relies on. Insurance is no longer an essential middleman. It becomes an option, and for many people, useless. With transparent pricing, private practices are positioned to compete, restoring control and leadership to physicians and patients. Medicare would not need to negotiate. They'd know the price and they'd pay it, or they wouldn't. No convoluted contracts. There are no hidden expenses. For the government and for taxpayers, this is a chance to drive real value for people without the continued inflating of expenses. Healthcare for America would work as intended. Self-funded employers would build their networks with zero friction. Employers could handpick practices and design plans that reflect the needs of their employees. And they could skip the insurance company altogether. When prices are public and transparent, by the way, this is easy work for an actuary, you can plug in the numbers and let the data drive the decisions. Now, some people push back on this idea. In fact, there's a bunch of you on LinkedIn and X. They ask, how will patients shop, Dutch? They throw up numbers like they're impossible to handle. Let me help you. There's about 18 billion medical treatments and services rendered each and every year in the United States. 15 billion of those are lab tests, 1.2 billion are consults, 400 million physical therapy visits, 300 million radiology services, 75 million outpatient procedures, and about 11.5 million ER to ICU occurrences. These numbers represent a healthcare system already forcing patients to shop. It's just that they're shopping without the information they need to make informed decisions. People are out here navigating choices without a price guide, and they have no idea what they're going to pay until the bill hits their mailbox. That's not a functional system. In the Marine Corps, we call that an ambush. Price transparency is not about turning patients into bargain hunters for every x-ray or physician consult. It's about giving them an essential tool: choice. Patients and employers and taxpayers must, not should, be able to see where their money goes and make decisions in their best interest, not the interest of the opaque hospital pricing or insurance company markups or fake discounts. When we talk about these billions of services, treatments, and procedures, we're talking about hundreds of billions of dollars wasted on hidden fees, inflated prices, and a complete lack of accountability. By making prices transparent, we're not expecting patients to know every nuance of care, but we are enabling them to ask questions and trust that the system isn't working against them. This isn't fantasy land. This is common, pragmatic sense, and the data supports it. Price transparency reduces expenses and creates lower prices. That is a fact. Insurance companies will fight this because their models depend on keeping patients in the dark and employers stuck in high-cost plans. Why? Because people profit from the opacity. Physicians, you have a choice here. You can lead, or you can continue doing what we've got so far. Post your prices if you want autonomy and control over your practice, your patients, and your business. Take away the insurance industry's edge. Give employers a real option and make healthcare accessible for everyone. The most significant shift in healthcare isn't technology or policy. It's visibility. It's about putting information where it belongs, in the hands of physicians, patients, and those paying for care like employers. If we want to disrupt healthcare, we must start here. Thank you for listening. Rojas out.